So this is the MedCognito TDM web class. Not so many people are qualified to take the TDM because the TDM, you need an invitation to write it, but I'm not going to go into that. Dr. Alex will deal with that, you know. So tonight we're going to look at the secrets to know in the TDM exam preparation.
Right, great. So I'm going to start with this quote just for us to reflect on. And it's a quote from the famous basketball player. It says that obstacles don't have to stop you. If you run into a wall, don't turn around and give up. Figure out how to climb it, go through it, or work around it. As IMGs coming from various backgrounds, India, Egypt, Sudan, Congo, Iran, Pakistan, wherever you may come from, I share your frustrations, I share your sentiments. Licensure in Canada is a very difficult task, and we are faced with so many obstacles. And so this quote is just to let you know that no matter your situation, no matter the obstacle that you're facing, it shouldn't stop you. You can find a way around it. And this webinar is going to show you how to find a way around the TDM exam. So what is the TDM exam? The TDM exam is an exam that is aimed at assessing your therapeutic knowledge. And it's comparing you to the standard of a trained family physician practicing in Canada. Now, previously, it used to be based on province by province. So various provinces had their own TDM exam. However, what is pertaining now is a pan-Canadian initiative. That means that regardless of the province that grants you TDM invitation, it's applicable to all of Canada. So it's a 3-hour exam. You have 30 minutes prior to these 3 hours just to answer do a trial. The MCC would give you the interface, so you play around with the interface, so you familiarize yourself. You're going to watch some security information about confidentiality of the tests, etc., etc. That will take you about 30 minutes. And then the 3 hours is what is the actual test. Now you will have 40 cases, all right? Each of the 40 cases will have 2 to 3 questions under them. The cases are set up in scenarios. So they are usually what we call clinical vignettes, all right? Now, the total mark is 100, all right? And you need 60 and above to pass the exam. The next exam dates, January 18th and January 7th, 2022. Now you have the option of going in person for the exam, or you have the option of taking it from home. That is the proctoring. Okay. Now it's very important to know that you have only 1 attempt per calendar year to take the exam, and you have 4 live attempts. That means that if you do not pass, if you attempt the January exam and don't pass it, you have to wait until 2023 to pass the exam. And I will touch on the implications for this later on. Now, what is the scope? What is the exam going to test? The exam is going to test areas like acute illness situations, ER situations, admission orders, when to refer, when to consult, etc. It's going to test chronic illness, all right? It's going to test things like health promotion and illness prevention, your awareness of drug classes and the safety profile of medications, how you prescribe adverse effects, 2nd and 3rd line order medications. Another thing that it tests is your awareness and understanding of alternative forms of therapy, all right, such as physiotherapy, chiropractor services, home care services, etc. Now, you would also need to understand how to negotiate a therapeutic contract, for example, as relates to certain classes of medications, okay, that have high adverse effects profile, and then also on issues of drug abuse, as well as advising patients on therapeutic options. Now, you would realize that this exam is unique in comparison to QE1 and the NAC. Because unlike QE1 and the NAC that are testing you at the level of, say, a resident or a final year medical student, okay, the therapeutics exam is testing you at the level of a family physician who is about to practice. So things like the name of drugs, the dosages of drugs, the routes, and the frequency need to be at your fingertips. And the exam questions will state what is required. So for example, if the test item is going to ask you for the name and dose, that is what you will provide. If it's going to ask for name, dose, and routes, all that will be stated in the stem of the question as well. So I'm going to use a sample question to illustrate to you how the TDM questions are like, okay? So we're going to try this. Is anyone in the audience wants to read so that you don't have to listen to my voice throughout? Anybody?
I can read.
Okay. Sure. All right. Is that Lizzie or CJ?
Stino.
Hello?
Yes, Stino.
Yeah, Lizzie is taking over.
All right, sure. Please do. Go ahead.
This is Dr.
Nelson?
Tino, right?
Okay.
Yeah. Yes. Okay, it says Nelson is a 52-year-old man seeing you by phone appointment to discuss continuation of his proton pump inhibitor PPI medication. He initially saw you 6 weeks ago with some burning in his throat and epigastric pain. His investigation results are as follows: Helicobacter pylori negative, endoscopy normal findings. He suddenly stopped last week and felt burning pains again and is therefore afraid to stop. He states that he feels great with the medication and would like to continue the tablets.
Good. Thank you very much, Dr. Tino. All right, so we have the questions here. Will someone else volunteer to read the questions? I want another person. Anybody else?
Okay.
Okay,
Number one. Okay.
Okay, please go ahead.
What caused the recurrence of his symptoms? State 3 non-pharmacological measures to alleviate his symptoms. Write a prescription for a commonly prescribed PPI. State the name and the dose. Other than drug allergic reactions, state 5 long-term side effects of PPIs. Identify 3 options for reducing PPI use. State the 3 conditions for which your prescribing recommendations above would not apply.
Thank you. Thank you very much. So you see the way the question was a case scenario. That is how your questions in the TDM exam will be like. It will be given to you in the context of a situation. So in this case, it's a telephone appointment and the person, this is not an acute situation, right? It's important that you know the context in which the case is presented, okay? So let's try and then do a brief discussion of these questions just so that you have a feel of it and that this exercise, this whole webinar is beneficial to you. So anyone want to attempt question 1? What caused the recurrence of the symptoms? Anyone want to, you can type in your questions. Don't be afraid, don't be scared to get it wrong. We are all learning here. So just type in what you think. And one thing before you type in, for the TDM, you're not supposed to write so many words. Okay, you're not supposed to write so many words on the line. Your answer should be a few phrases. It shouldn't be 3 sentences, 2 sentences long, a few words. All right, so that's the clue. If you're writing too much, you are probably likely not to score the points. All right, so just type in a few words what you think could be the cause of the recurrence of the symptoms. Let's see. This is question number 1. We are answering question number 1. Okay, I see men 2 here. Anyone want to try? Get 2 cups of coffee. Okay, weight loss, smoking cessation. Oh, we are doing question number 1. Dyspepsia, weight loss. H plus secretion rebound. Okay, interesting. GERD. Yes, we're doing, yes. I see GERD. Okay. All right. Interesting set of answers there. All right. Let's move on to question number 2. State 3 non-pharmacological measures to alleviate his symptoms. Okay, I see relapse of GERD. Okay, so May Ibrahim is responding to question number 1 with relapse. Okay, so as now we see the non-pharmacological measures coming in. Awesome, awesome. Great. Small meals, reduce smoking. Right, less fat in nutrition, no spicy food. Smoking cessation. Okay. Right, great. Okay, now let's look at question number 3. Write a prescription for a commonly prescribed PPI. Write a prescription for a commonly prescribed PPI. Now, pay attention to the instruction there in the comments. State the name and the dose. State the name and the dose. Okay, I see omeprazole 20, omeprazole 40. Remember that the question is asking for name and dose, not frequency. So already I'm beginning to see those who are not following the question instructions. Name and dose. Awesome, awesome. I see answers coming in, yes. All right. Okay. Please remember the question is asking for name and the dose. Follow the instructions. This is very important. So if you are saying per day is not the name and dose. Per day is frequency. But I like the enthusiasm. I like the enthusiasm and the participation. Awesome, awesome, awesome. Great, good. Okay, so someone has stated only the name. Okay, okay, all right. Now I see Hanani has added the dose. Great, all right. Now let's move on to question number 4. Other than drug allergic reactions, state 5 long-term side effects of PPIs. 5 long-term side effects of PPIs. Okay, I see the answers coming in. Okay, 5. If you're stating 2 or 3, you're not going to score the full mark. Awesome, awesome. 5. Right, right. Okay, I see B12 deficiency. I see fractures, infections. Okay, headache, nausea. They say people always put in nausea when they run out of ideas because they think every medication will give you nausea and vomiting. So sometimes you may have a stem that says aside nausea and vomiting. Interesting, interesting. Okay, now let's move on to the number 5, question number 5. Identify 3 options for reducing PPI use. Let's see what answers people can give for this. 3 options for reducing PPI use. I want concise answers to this. 3 options for reducing PPI use. Okay, lifestyle modification. Antibiotics too. Okay, someone, I see Luma says I couldn't get the question. So the question is question number 5, and the question is saying, identify 3 options for reducing PPI use. Okay, so you have options. How will you reduce PPI use? What are the options you can employ to reduce PPI use? So you need to understand the question very well. Okay, you're a physician, you want to reduce PPI use in this patient or stop it altogether. What options can you use? Okay, I see dietary management, weight loss, antacids. Okay, let's see. We'll review the answers together. I hope I have clarified that question. Is it Luna? Someone said the question wasn't clear. I hope, Luma, I hope the question is clear now. Understanding the question is part of the whole exam scenario. And it's important because in the TDM, the diagnosis often will not be clear. It will be assumed that based on the information that you have been provided in the vignette, you should understand and appreciate what disease condition is being discussed. And as a family physician, be able to know common therapeutic approaches that are within the family physician realm in Canada, topical issues, okay, as it were. So these things should become common knowledge. Things like deep prescribing of a PPI is very topical in Canada here. So it's something that they would, it's likely, you could easily be tested on something like this, okay? Now, moving away from, okay, I see resolution, okay. All right, we'll discuss the solution. Very good attempts though. I like the way I see a lot of answers coming in. I see people putting in solutions. This is very impressive. This is the best way to learn, to attempt questions and engage, all right? You may get it wrong, but then when you get it wrong and you get to know, oh, this is the correct answer, it sticks in your memory and you are less likely to forget. Okay, so let's move on to question number 6. State 3 conditions for which your deep prescribing recommendations above will not apply. So question number 6, all right, is in relation to the deep prescribing, okay? As in, which conditions will you not deep? Oh, good, I see answers already coming in. Zolenga, Ellison, Barris, Supergood, I see N. Okay, all right. I see allergies. Awesome, awesome. I see cancer. Right. More answers for question 6. Good. So it's possible you could read this topic from any resource material, but not be able to answer the questions as would be expected of a candidate by the test committee, and so you won't realize the mark. Remember that for any MCC exam, there's a test committee that meets to set questions and identifies recommended answers, okay? And your answer should be worded in a particular way, just like the way CDM portion of QE1 is marked, the same way the therapeutics portion is marked. So you need to use appropriate wording to formulate your answers. And reading the test material alone will not help if you don't actually practice question solving. So this is what at MedCognito we recommend, that intermittently you are solving questions from day one. You are starting your whole approach to this TDM exam by starting your first day solving the questions. Get some correct, get some wrong. You identify your weaknesses and you build on from there. All right. Oh, and say, sorry, I missed it. For how long is this test result valid? Oh, you mean for the TDM exam? So on the MCC page, we'll be sharing that soon. It used to be 2 years, all right? And that's what, as far as I know, but we'll share that and update you on the current recommendations. But as far as I know, it's a 2-year period. If you pass, if you don't pass in your first attempt, you have to wait for 1 year before you can take it. And you have 4 lifetime attempts. If you write the TDM 4 times and you fail, you cannot attempt it again, all right? And it's important to know that when you are applying to the provinces, they want to know if you have failed the TDM exam before. And if you have failed the TDM exam before, then you are not a very competitive candidate. Not that you cannot enter the program, you may, but they would rate candidates who have passed on 1 attempt. All right, so you see how important this TDM exam is. You need to get it right, because if you don't get it right on the first attempt, what it means is that you are delaying your whole starting of practice, all right, by 1 year, which is unnecessary, all right? You have to make sure that you are putting in all the resources that you can to ensure a pass on the first attempt, all right? So that is very important, and is a point that I want you all to bear in mind. If you don't pass on first attempt, you have to wait for 1 whole year. So if you are taking the exam in January 18, 2022, and you don't pass, touch wood, you don't pass, you have to wait until January 2023. This is a delay, and this is avoidable if you are planning and preparing well. And that's something that I'll urge all of you to consider. All right. So now let's look at the answers. So this patient was on PPIs. He stopped it and is having the burning sensation again. All right. The reason is what we call acid rebound or rebound acid hypersecretion syndrome. This is what is causing the burning sensation or the recurrence of his symptoms. Okay, some of you got it here. And the reference material for this is in RX files under the topic PPID prescribing. PPID prescribing is a very topical subject among family physicians in Canada. You can also reference this from UpToDate as well. Okay. Now, the next question, which so almost everyone got it right, is non-pharmacological measures as well. Now, non-pharmacological measures comprise of 30% of the questions that will be on your TDM exam, whilst pharmacological will comprise of 70%, okay? As far as the blueprint framework for the TDM exam is concerned. And when you join on our Facebook group, we'll be sharing some of these things. What is the blueprint about? And how can we use the blueprint to our advantage, okay? So that we can predict where, for example, if I know that you have 2 weeks or 3 weeks to take the TDM exam, there are areas where I can tell you to focus your attention on, all right? Whereas if you have 6 weeks, we also know the strategy to use to help you to ace the exam, all right? Because the blueprint shows us which areas the marks are weighted more on, all right? Okay, so these are some of the answers: non-pharmacological measures, dietary modification, reducing body weight, avoid eating up to 3 hours before bedtime, avoid lying down after meals, smoking cessation or stop smoking. You realize that the answers are really short, concise, and straight to the point. And this is how they want you to answer the questions. They don't want you writing very lengthy sentences, all right? If you're going to say smoking cessation is fine. If you say stop smoking, that's fine. Avoid alcohol avoidance, avoid tight clothing. No, regardless of how you frame your answer, once the key points are there, you score the point, all right? And this was from what we call the CTC, the Compendium of Therapeutic Choices, 2019. So let's move on to number 3. So number 3, the whole list is there. Okay, the whole list of medication is there. So this question, so I saw people writing once daily, BID. That is not part of what the examiner is asking from you. All right, this is why I'm saying it's important to practice actually solving questions, because you may think you have the knowledge, but you may lack the exam technique. And the exam technique is important. After all, what is the only way that the examiner can assess your knowledge? It's from what you put down, not your knowledge, because nobody knows it. It's your answers is supposed to reflect your knowledge. But what we really realize is that there are people who have the knowledge, but they don't have the exam technique. And if you don't have the exam technique, you could fail for an exam that you have all the knowledge, right? So if you're writing daily, remember that is frequency, right? That is frequency. If you're adding oral, PO, that is the route, and the examiner is not testing that. Okay, so if you're writing daily, daily is telling you the frequency at which the medication is supposed to be taken. All right, the exam, if you read and you have to read the question carefully, it says name and dose. So you write the name and the dose. That's it. Nothing more, nothing less. So if you write any of these, rabiprazole, 20 milligram, so ignore the daily up there. That was a mistake, all right? And that is to show you not to do that, okay? So if you are writing, so rabiprazole is the name, the dosage is 20 milligram. This daily here, which some of you wrote, okay, daily, this would be frequency, all right? And if there's PO, PO would be the route, okay? So don't do this. Don't do daily. Don't add daily when the question says name and dose. I hope that point is clear. So don't write the drug name, write the drug dose and add the frequency when the question is not asking you to add the frequency. All right, let's move on to number 4. So long-term side effect, any of these is fine. So if you wrote enteric infections and if you stated any of these specific infections, that's still fine. If you wrote fractures or osteoporotic fractures, that is still an acceptable answer. Pneumonia, spontaneous bacterial peritonitis, hypomagnesemia, acute interstitial nephritis, vitamin B12 deficiency, any of these is acceptable. So now this was a question that I feel in terms of, I feel a lot of people didn't do well on this particular question just from cursory look at the answers that came in with respect to the options for reducing PPI. And this I can understand because a lot of us have not actually been in the situation of practicing here. Maybe perhaps people who have done observerships would have had the experience, or who have worked as clinical assistants or physician assistants. But the options you have are you could reduce the dose. If you want to discontinue PPI, this is the options you have. You could reduce the dose. You could stop the treatment. You could do on-demand dosing, intermittent dosing, or you could replace with an A2 receptor antagonist. So these are the options that you have, all right? And this is from RX files. The same information is also from Choosing Wisely. Okay, and Choosing Wisely is one of the key resources that we will mention that in MedCognito we use for as our reference, all right? So Choosing Wisely recommends that you don't maintain long-term PPI therapy for GI symptoms without an attempt to stop or reduce the PPI medication at least once per year in most patients, all right? This is very important. There's also, I have highlighted down there that deprescribing opioids is also a very high yield area that we should focus your attention on. Similarly, doing same for benzos as well, benzodiazepines, okay? So it's a strategy, like every exam, there's a strategy to it, there's a method to it, right? And if you are able to structure and come up with a good strategy, then the exam is like a breeze for you, okay? All right, so we said conditions where your prescribing recommendations will not apply. That means that conditions for which you would not be able to try to reduce the PPIs, okay, either by doing it alternatively or reducing the dose or doing intermittent dosing or replacing by H2 receptor antagonists, those would not apply. And quite a number of people got that correct. If you have a patient that has Barrett's esophagus, severe esophagitis, if there's bleeding, GI bleeding or chronic NSAID use with bleeding, these candidates, this patient group will not be eligible for the prescribing recommendations, all right? So that is just to give you a glimmer of how the TDM is. You are unlikely to have questions with this number you are unlikely to have a case with this number of questions. Mostly you're going to have 2, at most 3. But this is to let you have an idea. You know, question 1 wanted you to know the rationale behind a symptom recurrence, which is also part of the therapeutic decision making. Sometimes they will ask you, what is the rationale of giving this medication? What is the rationale of discontinuing this medication? So these are things that you must know. You must appreciate the rationale. You must always appreciate the rationale behind it, okay? So, and then we went through the non-pharmacological measures. Then we came to pharmacological. Then we came to adverse effects. Then we came to options for discontinuing. So rationale. Then we came to another rationale, patient group for which your option for reducing would not apply. So it's important that you read the question carefully. It's important. There are no negative marks. So when you are stuck and you're not sure, I would recommend put an answer there that you think could be plausible, but don't answer what is not asked. If you are not asked to put frequency, don't put frequency. If you are asked to just give name, don't state name and dose. Just put the name. All right. And always give the best possible answer. All right. So all I'm going to tell you is that keep calm and you can ace the exam. I know there's a lot of anxiety. There are people who have taken the QE1 and NAC and are worried about whether or not they can make this high stakes exam. So I'm just here to tell you to keep calm. It's doable. There's a method to it. There's a strategy to it, and we can help you to achieve that goal. So I've mentioned some of these things already. So if you are doing 100 questions in 3 hours, you should not spend more than 1.8 minutes on a question, right? You shouldn't spend so much. You shouldn't spend 2 minutes on a question, all right? Because you don't have much time. Be as brief as possible, be as specific as possible. If it's hypothyroidism, you don't go and say thyroid disease. That is very vague, right? And don't over-answer. If you're asking for 3 questions, if they're asking for 3 recommendations or 3 non-farm measures, give that, all right? If none is stated, give as much as you can, all right? If none is stated, then you know that it's an open, but that is very unlikely. Most of the time, they are very specific, all right? Give one answer per line, just like the CDM. You don't answer 1 and then answer 2, and don't merge 2 answers on 1 line. Don't put Barrett's esophagus and bleeding on 1 line. You lose the points. State each of them on different lines, okay? And also, don't provide a range. If you are going to state 20 milligram omeprazole, 20 milligram, don't state 20 to 40. No, that's not acceptable. Always be specific, all right? And give the actual dose or in milligram per kilogram of the body weight. Either is acceptable, all right? Spelling errors will not hurt your answer, but it has to be readable, okay? All right, it has to be readable. So these are the books that I will recommend, we will recommend. And what MedCognito does is to fuse all of these resources to give you very high yield material that can ensure that your learning is targeted. Of course, from now until January is just about 3 months, and you cannot spend all the time reading all these voluminous books. The compendium of therapeutic choices, CTC, is over 1,000 pages. RX files, you cannot exhaust it. RX files it ranks up to the level of up-to-date. And those of you who have up-to-date will know that it's a reference material. It's not a book that you can read in detail. So really what you need is a prep course or material that has gathered all the high yield facts, what is topical in terms of Canadian family practice, and is high yield and is likely to be tested, and condense this information and present it to you so you can go over it, practice it, and guide your reading so that it's easy for you to remember and that you have all the confidence that you need for the exam. So we're using compendium, we're using RX files, we're using Choosing Wisely Canada up to date. There are so many that we can't mention here, Bugs and Drugs. There are so many other resources that all come in to present the material that MedCognito will make available to you. All right, so are you ready for the next session? All right, so I've talked about this already. I've mentioned that this is the level that the MCC will be testing you at as the level of a family physician who is about getting into independent practice. And there are so many review materials that we will give you. Some of this we'll put on the Facebook group. So please join the Facebook group. It's very important. We'll be reviewing what is on the candidate information sheet. We'll look at what is on the CPSC website for those of you, those who are in Alberta or who have applied for TDM through Alberta will be familiar with some of these things. Those who have applied through BC will be familiar with some of these material as well. So let me end with this quote. Sometimes we are tested not to show our weaknesses, but to discover our strengths. The TDM is like one of, any of the exams that you have taken, and we are here to help you to ace the exam on your first attempt. So on that note, I will hand over to Dr. Boni to continue with the rest of the session. And I'll be here in case you have any questions, feel free, okay? Dr. Boni, I hand over the baton to you.
Sure, Dr. Lex, sure. Let's get things going. Is Narcoski
So So,
Dr. Alex.
Dr. Bruni, yes. So the TDM is an exam for which you need a province to invite you. Now, various provinces have various criteria, okay, to invite you. So, for example, Alberta may say that Kiwi 1 and then IELTS, and you need to apply for medical registration on Physician Apply, okay? SIPA may say that we want Kiwi 1 and we want NAC, and then we'll give you the invitation, okay? So what you do, in order to know, you need to contact the various colleges, all right, and then submit an application, and then they will determine whether they'll give you an invitation or not. So it's not a one size fits all right? Alberta may have its standards, Nova Scotia may have its standards, Newfoundland may have its standards, Saskatchewan may have its standard. So generally, a lot of them will want you to take NAC, all right, but some do not, okay? So that's the answer to that. I hope that satisfies it. So the answer is based on which province you are talking about. Okay, and we can go into details on our Facebook group as to what specifically is requested for. If we want to delve into that, we will not finish this webinar. It took
Dr. Zia just took the NAC. You wanted to say something. Dr. Zia, I know you're not part of MedCognito in any way, but will you want to just say something to your friends who are asking about NAC?
Hi, Dr. Bruni. This is Dr. Zia, guys. I did the NAC mock with Dr. Bruni, and it was a great orientation before the exam. The exam was very similar to the mock that I did with Dr. Bruni. So I would really suggest, if even not the course, go for the mock with Dr. Bruni, definitely.
Doctor, I think one of the candidates has already enrolled in the course right now. Dr. Tino, I have a question. Will you mind, maybe from a user perspective, will you mind maybe sharing just a little how you see the course now you've enrolled?
Okay, thanks, Dr. Bruni. So yes, I have enrolled in the course and I've been able to start using the materials, and I have found them very, very helpful now. Being able to, get the information on the go, just like you said. So now it's just on my phone. I play each of the videos quickly and I get the information that I need. And more importantly, the approach to the video is not like just downloading the textbook. It is addressing the questions that you could be asked on that particular condition, which I think is really the key part, like what you did today, Dr. Alex. So I have found it very helpful. Thank you so much.
Dr. Tino, thank you. Not from Nigeria. And so do you have to be a family physician to pass TDM? No, no. I've had people who are pathologists. I've had people who were, obstetricians and gynecologists, who have passed it. And then someone asked, can you take them the TDM even if you're out of practice? Dr. Alex, can you answer that for them?
Okay, so let's assume that you have the eligibility or you have been given the invitation. And let's say you haven't practiced for a while, right? So the question is whether you can prepare and take the exam. Is that if I'm getting the question right?
Yes, so that's what the person is asking.
In terms of, so what are all the input of all I've done today is to let you know that there's a strategy and there's a method. Okay, it's an exam and there's a way that you can prepare and take the exam. So yes, regardless of how long you've practiced, all we need from you is your participation and your engagement. Just show up. Just show up, watch the videos, come for the mocks. Just show up and come for the mocks, and that's it. And you're going to pass the exam.